And right now, all local testing for the coronavirus goes through the Department of Health.
But tonight we've learned Rhode Island's two largest hospital groups are working to conduct their own tests, in part to find out just how widespread the virus really is.
Eyewitness News reporter Kim Kalunian joins us now live in studio with the details. Kim?
Well, Mike and Caroline, doctors say about 80% of COVID-19 patients have mild symptoms. So if the state is only testing the sickest people, we might not have an accurate picture of how widespread the virus truly is. And local hospitals are hoping to get to the bottom of that predicament, and soon.
I do presume that there's more spreading around.
Dr. Jeremiah Schuur is the chief of emergency medicine for Lifespan. The hospital group is currently working to conduct its own testing for COVID-19 or the novel coronavirus.
What we haven't been able to do is have wider testing of people who may have symptoms that possibly could be coronavirus but aren't very ill. And so that's important just to determine if there is spread in the community.
Care New England is also petitioning the state to administer its own tests.
We need new equipment to do that, but I think we're hoping and anticipating over the next week or so, perhaps we can do the cultures ourselves.
The goal among healthcare workers to ensure there's not a rapid increase in cases that would overwhelm ERs. Schuur says things like hand washing, staying home if you're sick, and social distancing not only protect you, but others as well.
And you can imagine if there were 5 matches all next to each other, you light the first one and they all get lit. If you pull one out of the line, those first 4 or 5 burn, and then there's a gap and things don't spread. And so as much as we can do that in our communities and our workplaces, we will limit the spread.
Now, neither Lifespan nor Care New England provided a firm timeline for when they'd be able to start their own testing. But Dr. Schuur says folks should expect to see increased availability of tests coming soon. Live in studio, I'm Kim Kalunian, Eyewitness News.